Welcome to part 4, called fecal diversions, also known as ostomies. Sometimes our patients have a condition that requires them to have a fecal diversion or ostomy created. This is a temporary or permanent surgical procedure that creates a hole in the abdominal wall, takes a portion of the colon and attaches it to that hole, so all fecal matter exits the body through that hole instead of the rectum and anus. These pictures of ostomy locations are showing ostomies that exit fecal matter formed in the large intestine or colon, and they are called colostomies. The reason a person needs a colostomy could be due to cancer or several other diseases you'll learn about in higher blocks. The placement of the colostomy is determined by the disease that required it, so I can't say that you'll see it here versus there, but they can be placed anywhere along the colon. The most common locations we see are in the sigmoid or descending colon on the left lower side of the abdomen. The next common locations are the transverse and ascending colon. Because the stool is exiting the large intestine, the stool is typically soft to formed, and if it's in the sigmoid colon, it can be just as firm and formed as a normal bowel movement exiting the rectum. There is another type of ostomy that exits the stool before it even reaches the large intestine, called an ileostomy. Because it's bypassing the large intestine, there is little reabsorption of water, so this stool is generally liquid or maybe slightly soft, but it is not formed at all. Ileostomies are usually permanent, but not 100% of the time. Ileostomies also have a high risk of skin breakdown around the opening because that stool is liquid and it can easily leak. Ostomies are life-changing for the person who has it, either in a good way because it's fixing the issue that required it in the first place, or in a bad way because now they have a pouch of stool hanging off their body, and that has a lot of mental health and social implications. The patient also has to take care of this when they're not with a nurse. A lot of what a nurse's role is when it comes to caring for an ostomy is education and emotional support. If the ostomy is new, the patient might not even look at it at all. There's a lot of depression with a new ostomy because of the major life and body change. Nurses encourage patients to look at their ostomy and then start teaching about how to care for it. They can't learn to care for it until they learn to look at it and accept it, and that can take time. We provide emotional and social support to the patient, helping them learn to live their life with this new ostomy. They have to live, work, and be social with this. They need to know what to do in all situations, how to act, what the resources are, and who to turn to if they're not doing well. A major issue with ostomies is the smell. Remember, they're not having a bowel movement into a toilet with the door shut. It's occurring on their abdomen into a bag. We have to teach them ways to be as odor-free as possible and how to empty the bag, or appliance is what it's actually called, frequently. They need to know how to assess the hole or stoma and what they need to be looking out for. They need to know how to keep the peristomal skin clean and dry. If the stool leaks onto the skin, the digestive enzymes present will eat away at the skin, just like it will with diarrhea. Everything we do to care for the ostomy must be taught for the patient, and we do a lot of education when it comes to ostomies. Stomas can come in many different shapes and sizes depending on the patient's anatomy and where the stoma is located. Some stomas are flush with the skin and some protrude out of the skin. Despite all of these differences, there are some things that should never be different, and that would be the color. Stomas should always be a dark pink to beefy red and should always be moist. If the stoma is not looking dark pink to beefy red and moist, if it's pale or dark or looks almost black, there's a major medical emergency occurring. The stoma is not getting blood supply and the tissue could be dying. The skin around the stoma should be intact and healthy and of normal skin color for their ethnicity and other surrounding skin. If there's any redness or breakdown or pus or anything oozing from the skin, there's a problem that must be addressed. An ostomy appliance is the collection bag system that attaches to the peristomal skin. There are many brands and types out there, and sometimes we use what we have, and sometimes patients have very specific appliances that work best for them. One type of appliance has the bag and barrier, or the adhesive piece that sticks to the skin, attached all in one, and another type, the barrier and the bag are two separate pieces that fit together like Tupperware. The benefits of two-piece appliances is it can be customized to fit your regularly shaped stomas easier than a one-piece appliance. Sometimes the appliance can't be made to fit a stoma perfectly, so we need to use stoma paste to help create more of a barrier between the stoma and the appliance barrier. This first picture shows different types of appliances. The second picture is showing a well-fitting barrier on a stoma that is protruding. And the third picture shows a barrier attached to the skin with a ring of yellow paste around the stoma. The paste is stopping any stool from touching the skin. When in doubt, we can always use our resources to help us determine what we should be using, and that resource is a special nurse who is specially trained in wounds and ostomies. All appliances have an opening at the bottom of the appliance to allow for drainage of the stool. Some brands of the two-piece appliances don't have that opening, and we would just separate the barrier from the bag and then attach a new bag. It's usually really simple to care for these ostomies. If the ostomy is regularly shaped, if it has no peristomal skin issues, and if the appliance works well. If we have issues with any one of those things, caring for an ostomy can be very difficult. It's very important that patients with ostomies follow a healthy diet. For the first 6 to 8 weeks after their ostomy is created, they should be eating a low fiber food diet so the stool doesn't get too formed and too solid. The stoma is still healing and it needs a soft stool to exit so it doesn't get damaged. We also want our ostomy patient to stay well hydrated all of the time. Patients with ostomies can get constipated, and if they do, they don't have that rectal muscle to push the stool out, so constipation becomes a very severe problem quickly. This means ostomy patients need to avoid foods that can cause constipation and blockages, especially nuts, popcorn, and food with skin and casings like corn. We also want them to avoid foods that cause gas like broccoli because this will cause excess odor from the appliance and that can be embarrassing. If the patient's having a lot of liquid stool or the ostomy is an ileostomy or it's in the ascending or transverse colon, they may want to eat foods that help thicken the stool a little bit like dairy, bananas, rice, bland high fiber foods. I really hope that you can appreciate the life changes an ostomy comes with. It's much more than just having a new way to have a bowel movement. There's so much social and mental changes that go along for these patients that's just so hard to describe until you actually meet somebody who has an ostomy and actually get to listen to how they feel. It's a lot bigger than I can tell you in a PowerPoint. And this is the end of ostomies.